Dozier-Smith, thank you so much for your time today. We've enjoyed talking to you and getting to know you a little bit. Would you tell us a little bit more about your background and how you arrived here in this organization? It's a great story I'd love for our listeners to hear about.
Sure. I just remember growing up across these rural counties that we serve currently here at Rural Health. My family's originally from Perry County in Uniontown, and I just remember being 10 years old and running on my grandfather's farm. He was one of the largest black farmers here in this rural community, and he grew fruits and vegetables such as kale, greens, okra, and one of the things that I enjoyed the most over the summers were delivering fresh produce to elderlies in the community. And he used to make sure that I got up early with him, prepared the deliveries, and as payments, what he would give me was crackling skins, an AC root beer, and a pint of chocolate bluebell ice cream. So I didn't want for much because I knew what I was getting, and it was my favorite snacks. So I really enjoyed spending summers with him in Perry County. What I did not know is a little bit later that my mom, brother, and I would be moving to Uniontown permanently. And when we did, I remembered going to school in a more small rural community than where we were originally from, and just learning the history of my family in that area. Yeah. The Flagship Health Center for Rural Health Medical Program is actually located in Uniontown. And a part of my family history is my grandfather his family owned the land that the Housing Authority and the first rural health clinic is housed currently. So 15 years later, from being a child, I would have never thought that my life would come full circle, and I would move to Selma and serve as the executive director of the program, and be faced with the same doctors, nurse practitioners, and dentists that were there when I was a child. So coming back to an area where as a child you really don't know much about healthcare, why you need it, and how important it is in rural communities, to now being the voice of an organization that takes care of some of the sickest people in rural Alabama, it truly is a labor of love. And as a mom of four and health advocate myself, it resonates with me to make sure that the individuals that don't have access to the commercialized health care that you see in more metropolitan areas, that they get the same quality and access in rural communities.
Right. As far as some of the challenges that your organization faces, what do those look like, just kind of on a broad scale?
Sure. So as a community health center, first, we're nonprofit, which means there's not much profit. There is some profit. So the gaining access to funding to expand the programs, build facilities for increasing access to care to individuals in these more satellite areas. So there's metropolitan urban, which we're not, but rural and satellite areas. So finding ways to reach people who have social barriers such as transportation, language, or literacy. We are going beyond the service delivery of healthcare. It's how do we get to the people? So the transportation is definitely a big barrier, such as finance. The other is literacy. So having healthcare advocate or patient advocates that outside of registration, doing patient history, and then seeing the patients from a provider perspective, having people that can sit and assist patients with how to fill out the forms, understanding what health conditions they have or concerns, and medication. You don't find a lot of people that have time or can afford to volunteer to serve in those positions, nor do you find it where organizations such as this can hire people to do those types of jobs. So through grant writing and other partnerships, we're able to find retired social workers, nurses, or individuals that are transitioning into that field that want the volunteer hours, that looks great on their applications to serve in these types of capacities to assist those patients. Because literacy is a big thing in rural communities. You find that, grandparents, great aunts, great uncles, sometimes even parents did not finish high school, did not go to college, or they're almost, if they have children, the reading levels are almost, similar to where their children are. Right. And not to say that they're not great people and they're not doing their best, but sometimes people were in situations where they had to work instead of continuing their education. Right. So as an organization, it's not just the finance, the transportation, or their barriers. It's making sure that people understand the purpose of us being in these communities as healthcare providers, but also making sure that what we're providing them makes most sense for them. It's affordable and accessible to them.
Yeah, that's great. That's great. Well, you've done a phenomenal job in the 5 years that you've been as executive director here. I know you told me earlier that you celebrated your 5th anniversary for being here earlier this week. Mm-hmm. And I think you also said that you've doubled the amount of clinics that you started with 5, and now I believe you said you're up to 10.
Yes.
So tell us a little bit about, if you don't mind, some of the strategic initiatives that your organization is going to try to roll out in the next few years. I know that this past year, COVID might have put some things on pause, mm-hmm. but if you have an idea of potentially some of the things you want to do down the road, what would a couple of those things be?
Sure. One of the bigger initiatives is immunizations. Our current patient population are elderly geriatric patients. So as our medical workforce has aged, so have our patients. So identifying opportunities to bring more young adults and children into the facilities is one of the greater initiatives, because we have great services housed up under one location. So being able to offer all of those services, we have to have the need in the population to provide the services. The other thing that we are looking to grow is telehealth. We know that with this pandemic, what it's taught us is if people don't come to you, you have to get to them some type of way. So most families, whether it's a child or young adult, or an older adult, you have some type of smartphone or tablet or computer. So educating our staff in how to deliver care to that patient in the most comforting and personable way is something that we're trying to train our staff on. And we do know that there are barriers to that because not all areas in the community are built equal. So looking for partners to establish a telehealth station for patients that are not able to come out on a more routine basis if they're chronically ill to see us because of cost, because of transportation, or someone else's availability to help them, putting a location and making that investment in that community to do so. Mm-hmm. Another area would be really the mental health area of service delivery. We know that when we take the COVID pandemic in mind, for example, there are not just physical aspects to what's going on in this world. People are suffering mentally with the inability of engaging and interacting with their loved ones and friends. Some people lost jobs. Some people have lost family members, immediate family members in their homes. So coping and aiding them during this time outside of our day-to-day of annual wellness visits, routine medical visits, dental visits will be essential to us. And it also allows us to go into that last area of focus for us, which is school-based care. So assisting superintendents and board of educators and bridging the gap between behavioral health and social emotional learning with a community health center and with a school system is essential to our continuation of growing that particular population of the people that we care for in the communities.